Every medical practice is concerned about decreasing reimbursements and increasing overhead costs. There is little we can do to increase reimbursements. However, there's a lot we can do about overhead costs by improving the efficiency and productivity of our practices. One of the simplest methods is to decrease the no-show rate, a problem that torments most medical practices. You do the calculations. Each missed appointment costs the practice approximately $140. If you have 3 to 5 no-shows per day, you don't need an MBA degree to calculate that the lost income to your practice is a few $1,000s a week. Of course, you want to get back some of that lost revenue, and here are 4 suggestions how. First, motivate your staff. Second, use effective appointment reminders. Third, be smarter in scheduling. And fourth, make it easier for the patients. Here's how to make no-shows disappear. Many times the staff actually celebrates the no-show rate because it gives them a breather, and they are not motivated to keep the doctor's schedule completely full. You have to make the staff understand that open time slots are a loss of practice income and will ultimately impact their bonuses, and that a full, robust schedule improves productivity and profitability. When the latter occurs, the physicians need to compliment the entire team and say, "Thank you for creating a full day." They must be motivated in order for the following solutions to work. No-shows can be prevented by using reminding techniques. Begin by requesting 3 phone numbers for each patient: home, work, and cell phone. Automated systems can be used to contact patients, but these are not as effective as a human contacting them. Now there are programs that will provide an automatic text message to patients reminding them of their appointments. Work smarter, not harder, in your scheduling. Please note that the longer time interval between appointments, the higher will be the no-show rate. For example, patients who are given an appointment more than 150 days away have a 30% no-show rate. Compare that to patients with an appointment within 10 days of their last office visit will have less than a 5% no-show rate. I suggest that you target patients who are likely to miss their appointments with a warm confirmation. Potential targets are patients who have been given an appointment in excess of 150 days away, patients who previously have canceled appointments, patients who have scheduled procedures, and patients within certain demographics or payer types who have a history of not keeping their appointments. You'll want to make scheduling easy for patients. E-scheduling can reduce no-shows. Programs on many practice management systems allow patients to see openings in the schedule and select their own appointment time, receiving confirmation of their appointment. Patients are less likely to be a no-show for an appointment that they choose. Make it easy for patients to cancel the appointment, which is difficult for patients to do in most practices. If a patient cancels an appointment, be sure to follow up on all cancellations and give the patient an opportunity to reschedule. Also, let the patient know that you appreciate the notification about the cancellation. I suggest you maintain a list of patients who would like an earlier appointment is another effective method of reducing no-shows and keeping the schedule full. When openings occur, the scheduler can go to the waiting list and contact patients who could potentially fill those open slots. Make it a habit to talk to repeat no-show offenders. I strongly recommend that the practice carefully document no-shows in the patient's records. Have a staff member ask the patient about the no-shows and how they might be eliminated. So what's the bottom line? It does not require rocket science to reduce the no-show rate. Attention to detail, looking at the no-show patterns, and motivating staff to keep the schedule full are simple solutions to solving the no-show problem and prevent holes in your scheduling and wreaking havoc on the efficiency and productivity of your practice.